This podcast is produced by Outcomes Rocket, your healthcare exclusive digital marketing agency. Outcomes Rocket exists to help healthcare organizations like yours to maximize their impact and accelerate growth. Visit outcomesrocket.com or text us at 312-224-9945. Hey everyone, welcome back to the Beat Podcast, recorded here at Vive in Nashville, Tennessee. I'm excited to be with Mark Whittington today. He is the managing director at HealthXL. Mark is passionate about improving healthcare outcomes for those who need it most, especially patients with chronic conditions. Mark, thanks for joining us.
Thank you. I'm happy to be here.
Yeah, it's great to have you here. How's the conference going for you so far?
It's going great. I mean, one of the more impressive I've been to. I think just the diversity of things you can do and get exposed to, the kind of the speed dating style of meeting with different companies has been really effective for us.
Yeah, I hear a lot of great reviews on that program. So glad it's working for you. Well, let's jump in, Mark. Talk to us about your organization. How are you all helping drive change in healthcare?
Yeah, our company, HealthXL, has been around since about 2016, which was really when chronic care management started to take off. And we were first really solely focused on that. And then just before 2020, we started to get into the remote patient monitoring space. And really the passion that we had is really being part of the change from just always seeing sick people and giving them ways to maybe improve their life a little bit or get on a bunch of meds and things like that and watch people's health conditions exacerbate and get worse. We wanted to be part of helping people stay healthy for longer, having a better quality of life. So there was really more to it than a business opportunity to us. It was a way to get involved in people in their lives when they're at a pretty vulnerable stage. And so it's been very rewarding for us.
That's fantastic. And so how can chronic care management and remote patient monitoring help address the physician shortage, which is another problem, and improve patient access to care?
Yeah, so it's really something that's evolving, and it's really still so new. But if you think about it, patients don't need to come into the doctor all the time anymore. So it used to be you've got a primary care practice, and all their patients are coming in, especially as they get elderly. They're coming into the practice 2 times if they're healthy, 3 times, maybe even 4 times throughout the course of the year. That takes up a lot of office space and time, and a lot of those things are very routine and could be handled through either a synchronous or asynchronous conversation with the patient, and also using some technology to monitor them and stay in touch. And also we have clinicians that speak with the patients on a regular basis. So we're kind of like the eyes and ears of the practice. And so it allows the practices now to spend more time on patients that are truly in need and need to see them face to face. So it actually, as a side effect, really creates more access for those that need it. And the ones that don't, we can manage them more through technology and through interaction.
Yeah, I think that's really great. And care in the home is becoming a big thing, virtual care. And the devices used to enable that are critical. So any thoughts around devices and kind of best practices there?
Still the tried and true is kind of the Bluetooth-enabled type devices in the home. What we use are very basic: blood pressure cuffs, pulse oximeters, glucometers, weight scales, things like that are very easy to is. So they're ones that they're accustomed to using. They've been used every time they come in for a doctor's appointment, pretty much their whole life.
Yep.
But what is most important is accountability and consistently using those and providing data through those. So really it's the accountability piece that we add and is what's most important. If they have them but they're not using them, it's not providing the additional data.
Love that. No, I appreciate the call out there. And what emerging trends are you seeing, Mark, that you feel are going to be a game changer in healthcare?
I think I'll leave the one that everyone would say to second, but I think more transparency and communication with the patient. So anything that allows, again, synchronous or asynchronous communication, they don't have to come into the office and we can stay in touch, whether those are devices, whether those are texting, whether those are apps and things like that. I think those are going to continue to create more efficiencies and more transparency for the patients. But the biggie is obviously AI. Everyone's AI is now the buzzword. Everybody's got at this conference. I mean, every third booth, there's something about AI. But I think we've got to intelligently think about how we harness that. I look now, we have a lot of data on our patients. We have a lot, if you're a hypertensive patient, well, we've seen thousands of hypertensive patients. So what are the things that we can start to glean from that data that we cannot really do manually? There's too many variables. I think AI can help us in areas like that. Predicting where their diagnosis is going, predicting when they may need intervention earlier, predicting we've seen this before because we've seen thousands of cases. How do we address that earlier? So helping with patient outcomes and things like that, I think, are going to be very powerful.
That's great. No, I appreciate the insight there. And honing back into the conversation to chronic care management and RPM, how are these going to help with value-based care?
The whole thing about value-based care is getting away from that fee-for-service model. Again, we talked about early how when someone's got an issue, you treat it. And what we do is we stay ahead and we try to identify things ahead of time. So that's why it's so important for us to be speaking with these patients regularly. It's amazing once they feel comfortable with our care coordinators, what they will share and that we can glean. You can also glean over a phone call. I've been talking to this patient for 6 months now. Something doesn't sound right this month. There's something going on. The memory's not quite there. Things we can elevate. And then when you add devices into the equation, you start to be able to monitor trends. So now I can see when subtle things are starting to change. And hopefully the doctor can adjust their medication, or we can identify that there's something else going on where they need treatment.
No, that's really great. A great opportunity to really use the chronic care management and RPM to provide that type of care that keeps people healthy. What have you seen are the biggest pain points that your organization's helping solve?
I think two of the things that I think of immediately are access and cost. Talked about it a little bit earlier. Doctors, there is a shortage in primary care physicians in this country. Not as many are going into it anymore. It's a tough profession. A lot of them are being purchased and owned by doctors now. So the fact that we can help them with patients, that we can help them other ways to access healthcare that's outside of the office setting. And then I think from a cost perspective, if we can stop these patients from getting worse and getting more unhealthy, we're going to eliminate cost in the system, not only for the patient, but for the overall health system at large. And I think the whole trend we're going to see over the next 20 years is getting people healthier. I think you even see what's going on in Washington right now. There's a lot of talk about how do we keep people healthier, because really that at the end of the day is the end game.
Totally agree with you, Mark. I think it should be the focus, and I'm glad we're shifting to that side of the equation. Are you guys focused on what population? Are you guys looking at Medicare, Medicaid, commercial, all of the above?
Yeah, mainly we work with all insurances, but mainly Medicare.
Okay.
So most of our patients are going to be 65 plus Medicare Advantage programs. We do a lot of patients that are what are called dual eligible, which have Medicare and Medicaid.
Got it.
In a lot of rural and more underserved communities.
Fantastic. So if that's your population, a great partner here in HealthXL for you guys to consider. How can practices make the most out of their chronic care management and RPM programs?
Yeah, engagement. So engaging with us. If a practice thinks they're going to bring one of these programs in and then they're just going to let it run on the side is something that's not changing how they operate, it's not going to be successful. But if the doctors start to embrace the additional information we're giving them and truly engage with us and open up, because it can change how they run their practice to something. They're getting access to things more timely. It's breaking the old models and getting into a new mindset. If they do that, these programs will be extremely successful. The other thing, if they can be proactive about directing the patients that need to be into these programs to us so that we can get them engaged, and not just expecting your chronic care management partner or remote patient monitoring partner is going to do everything. It needs to be a partnership.
I love that. That partnership's critical for success. Well, Mark, what closing thought would you leave us with, and where can people reach out to you and the team at HealthXL to learn more?
I think that awareness is the most important thing. It's amazing how these programs have been around since 2016, and still the awareness of them is still not as broad as you would expect. Adoption of these programs is probably in the 4.5% range of eligible patients out there. That's nothing today.
Yeah.
So I would just say that doctors need to be open to these programs. They're very busy. We know they've got huge things on their plate, but these things can truly make an impact on what most of them are in business to do, which is take care and keep people healthy. And these patients can help them do that. You can reach me at my email address at mwhittington@gotohealthxl.com, and I'm very responsive on that. And if anyone reaches out, I would be happy to talk with them.
Amazing, Mark. Thank you for that. Folks, make sure you check out the show notes for all the ways to get in touch with Mark and his team at HealthXL. There's an opportunity right here to leverage both chronic care management and remote patient monitoring to take your practice to the next level, enable value-based care, and improve outcomes for all. Mark, really appreciate you joining us.
Great. Thank you, Saul.
This podcast is produced by Outcomes Rocket, your healthcare exclusive digital marketing agency. Outcomes Rocket exists to help healthcare organizations like yours to maximize their impact and accelerate growth. Visit outcomesrocket.com or text us at 312-224-9945.